This video is for educational and reflective purposes only. It does not replace professional medical advice, diagnosis, or treatment. If you or someone you know experiences symptoms discussed in this video, consult a qualified healthcare professional. The good physician treats the disease. The great physician treats the patient who has the disease. William Osler. Medicine often focuses on visible symptoms, but some conditions challenge our understanding because the body sends signals that do not match the person's intentions. One of the rarest examples is known as persistent genital arousal disorder. Imagine feeling a physical state of arousal, without desire, without romantic thoughts, without attraction, without any conscious trigger. Now imagine that sensation lasting for hours, days, or even longer. This is the reality experienced by some people living with persistent genital arousal disorder. Persistent genital arousal disorder is a rare neurological and physiological condition characterized by unwanted genital arousal that occurs independently of sexual desire. The sensations may include genital fullness, tingling pulsation, pressure, spontaneous arousal sensations. The individual is not necessarily experiencing sexual interest. The body is responding as though arousal exists, even when the mind does not. Under normal circumstances, the brain, nervous system, emotions, and body communicate continuously. In PGAD, those communication pathways may become disrupted. The body sends signals that suggest arousal, but the conscious mind may feel completely disconnected from those sensations. The result is a profound mismatch between physical experience and personal intention. Symptoms can vary widely between individuals. Some people report continuous genital sensations, episodes lasting hours or days, sleep disruption, difficulty concentrating, anxiety and emotional distress. The condition can become physically exhausting and psychologically overwhelming. Researchers continue studying the condition. Potential contributing factors include nerve irritation, neurological abnormalities, pelvic nerve dysfunction, spinal abnormalities, medication, changes, vascular influences. In some cases, no clear cause can be identified. The nervous system appears to generate signals that continue long after they should stop. One of the greatest challenges is misunderstanding. Many people assume the condition is related to increased sexual desire. It is not. PGAD is not about wanting more stimulation. In fact, many individuals describe the experience as distressing rather than pleasurable. The condition often remains hidden because of embarrassment, shame, and social misunderstanding. Diagnosis may involve neurological evaluation, pelvic examination, imaging studies, medication review, assessment of nerve function. Because awareness remains limited, many patients spend years searching for answers before receiving an accurate diagnosis. There is currently no universal cure. Treatment approaches may include pelvic floor therapy, neurological treatment, medication adjustments, pain management strategies, psychological support. Some individuals experience improvement when underlying neurological causes are identified and treated. From a symbolic perspective, PGAD raises a fascinating question. What happens when a signal continues long after its purpose has ended? The condition illustrates a deeper principle found throughout life. Sometimes systems become trapped in repetition. A message that should arrive briefly continues indefinitely. A signal that once served a purpose loses its off switch. Most of us assume our thoughts, emotions, and bodily sensations are synchronized, but conditions like PGAD reveal that communication within the human system can be far more complex. The body and mind are partners. Yet occasionally, they speak different languages. Persistent genital arousal disorder reminds us that human experience is not defined solely by intention. Sometimes the body creates realities the conscious mind never requested. Understanding begins when we replace judgment with curiosity and assumptions with compassion. PGAD remains one of the least understood neurological conditions affecting human sensation. Its existence challenges common beliefs about desire, control, and the relationship between mind and body. And perhaps its greatest lesson is this: not every signal represents a choice. Some signals are simply waiting to be understood. If you enjoy exploring rare conditions where science and human experience intersect, like this video, and subscribe for future journeys into the mysteries of the human body and mind.